Hi, you guys. It's Dr. Alexis Carrington again. I'm our on-call room in the hospital because I am doing another night shift. So this is the start of my shift. It's around 7:30. I'm in the call room, got dressed, got the pagers, the regular pager and the code pager that will go off if there's any codes. So I got all suited up, and I just wanted to do a quick recording before I head on down to the floors and see patients. I just wanted to bring up some stuff because some of you were like, why are you in the on-call room? Do you guys sleep a lot? How has it been like in terms of sleeping and exhaustion? So for the past going on 2 months of dealing with coronavirus, normally when we're working overnight, we do get a chance to sleep for maybe 30 minutes to an hour, and on a really good night, we get to sleep for about 2 hours, maybe even 4 on the best night in the world. But ever since coronavirus, none of us, not even the interns, the residents, the volunteer attendings, none of us have been able to sleep or had time to sleep because we would all have admissions. We would have to deal with patients who could be decompensating and requiring intubation or escalation of care. We could be having codes at any time of the day, so this pager can go off at any time, and we have to respond to a code and be there within 5 minutes of the code alarm going off. Like, all of the beds are full with coronavirus patients, and coronavirus, I keep saying, it can switch like that. You can be stable 1 minute, and then all of a sudden your lungs can fail because of the virus, which could cause your heart to stop, and that would escalate to a code. So it could happen at any point, and because of that, none of us have been able to sleep. So I'm just sitting in the on-call room, but normally we have bunk beds that people would be able to sleep in, and we haven't been able to because it's just we don't have the time to sleep. And because of that, we have been exhausted because of all of this. Because of the increase in cases, we've been having to work just nonstop. So some of us have been working for 21 days straight, so almost a month straight. Some of us have been working 2 weeks straight. So I personally had been working 2 weeks straight with 1 day off of nights. It has been exhausting dealing with the same cases again and again, but even worse, it's physical, mentally, and emotionally exhausting because there's no way to cure coronavirus, and it is especially emotionally exhausting because we have patients who have left their families because no families are allowed to come here, and sometimes, and unfortunately often, they do not survive, and we have to call the family members who hasn't seen their family in a week, could even be more. Some patients have been here for almost a month, and the last time they saw them, they were walking into the hospital completely fine. And then because coronavirus can take a toll like that, we have to call them all of a sudden, explain to them, we're so sorry, that to say that your father or your mother, your brother, sister, husband, or wife is not doing well, or even the most dreaded call is saying they did not survive despite all of our efforts. And we always get the question from the family members, and it's a very understanding question, but doctor, we saw them walking into the hospital completely fine. Why are you telling me now that they are not doing well or that they died? And that is the most heart-wrenching question that we have to answer. And it's even more heart-wrenching because we don't have a good answer except to say that coronavirus, it can be lethal and it can change all of a sudden. And that is the best answer we can give, and it doesn't feel like it provides comfort or enough comfort to the families because we can't give a clear-cut answer. It has especially made me feel guilty as a doctor not being able to provide a good answer, and to say that even though we did everything, we could not bring them back. And it's even more heart-wrenching saying that to a wife who has a husband who just died from coronavirus, and he left his 2 young daughters, teenagers, and they will never see him again. And that is a conversation that I have had speaking to a wife who lost her husband and now their 2 daughters are going to be raised without a father because of this invisible disease, this invisible virus, this invisible pathogen. The very worst thing is that I've had multiple phone calls like that. And unfortunately, we still are having to give phone calls like that. So because of that, it has been emotionally, physically, and mentally exhausting and draining. Especially sometimes it feels like there's not much that we can do. It is heart-wrenching seeing this stuff, and my fellow co-residents, as well as the volunteer attendings and volunteer nurses, everyone definitely has felt feelings of guilt and overwhelmingness from this virus. But I do feel that we are making a difference, and that is something that our residents and co-residents have to keep reminding ourselves to keep going, that we are making a difference. So what really gets me is, even though we tell the family members that the patient or their family member passed, we are always told, thank you, doctor, for doing your best. And that always gets to me, in that they are still very gracious and thankful and appreciative for what we are doing, even though there are some times that we just could not save them, yet they are still thankful. It's tough, but it makes it worth it, and it makes me very humble and proud and thankful to call myself a physician.